With over 1,000 cases of coronavirus reported in Washington County and hospitalizations on the rise, the upward trend of COVID-19 is causing great concern, especially headed into the 4th of July holiday.
As we projected out, if we stay on the same trend, that's a big if, we don't know if that will happen or not, we'll be approaching 2,000 cases in the 5-county area potentially by the 4th of July weekend.
While masks aren't mandatory in Utah yet, health officials deem them essential. That's because many people may be carrying the virus and don't even know they have it until they're tested.
Approximately 1% of the asymptomatic elective surgery patients are testing positive. That's probably the best number that we have to suggest how many people are actively infected in the community right now. And that doesn't mean 1% have had this in the past. That means 1% are likely actively infected in the community.
And the state health department reports that for every person infected, the transmission rate equates to about 1.3 others getting the virus.
So from the time we see an increase in the number of cases until the time we see the death rate increase can be about a month. And so we don't want to find ourselves flat-footed or feeling complacent that because we haven't seen an increase in deaths yet, everything is okay.
1 in 4 people in Washington County are considered at higher risk because they are over age 65. However, the highest number of those testing positive for the virus statewide are middle-aged or younger.
40 to 49-year-olds had the highest percentage positive among those that were tested at 12.4%. 0 to 17-year-olds, 9.2% of those that were tested positive in the last 7 days.
If the numbers continue to increase, one concern is the potential for hospital workers to come down with the virus.
It stands to reason that our staff will be affected at some level of that as well. So at a time that we may need to have increased staffing, we may see decreased numbers of individuals that are available to help us out.
While hospitals are preparing for a surge, Patrick said there is no real cure that can magically save a life. Health officials highly recommend that the public practice safe distancing and wear masks.
So if we combine those two things, an 82% decrease by staying even 1 meter, 3 feet apart, and an up to 85% decrease by wearing masks, we can make a really big impact in our community.
And for those who are at high risk or do contract the virus, it's as simple as staying home.
Staying home really can make a big difference.
In Washington County, Melissa Anderson, Community Education News.